Have you ever panicked or become very worried when you experienced any sort of discomfort or pain in your abdomen, like cramping during pregnancy? Most of us get worried thinking that something is wrong with the pregnancy itself, right? So in this video, let me tell you about what are these cramps and why do we experience it in times during pregnancy? What is normal cramping and when do you actually have to rush to your doctor? And also some tips on how to manage these cramps at home. Hi, I am Saranya, the founder of Babypedia and a birth professional. I have 5+ years of experience and I've helped more than 2,000 couples manage and navigate pregnancy, birth, and postpartum with a lot of confidence. So, what exactly is cramping? So, cramping is any type of pain that you experience when a muscle contracts suddenly. So it can be ranging from any mild pulling type of pain to sharp shooting pains that can leave you feeling very shocked and surprised. So during pregnancy, cramping is very common and it can happen for multiple purposes. So when we look at it during early pregnancy, you may be feeling these mild period-like crampings that you usually get during your menstrual cycle, and this could be because of your uterus that is growing to accommodate your growing baby. It could also be implantation pain, where after fertilization, the fertilized embryo is traveling from the fallopian tube to the uterus and it attaches onto the wall of the uterus. So this is called implantation. And during implantation, some women may experience a lot of cramping with a little bit of bleeding at that time. This can happen anywhere from the sixth day to the 12th day after you've had intercourse and fertilization takes place. So now all this stretching, what happens is during pregnancy, when your uterus is growing, it causes these crampings, and your uterus is also supported by a lot of ligaments, like thin threads that are supporting the whole uterus. So imagine a hot air balloon, and when you think of the hot air balloon, what do you think? There are a lot of thick ropes that are holding the balloon attached to the basket below. So similarly, there are a lot of ligaments that are holding your uterus upright. So when your uterus is growing, these ligaments and the muscles around the uterus will stretch to capacity. And when you all of a sudden get up or you make any jerky movements, you move suddenly, these stretched ligaments will automatically contract to help protect your uterus and to protect itself from any damage. So that is when you experience these sharp shooting pains, especially around the sides of your lower abdomen. This will usually happen after 20 weeks on the later stages of pregnancy. The sharp shooting pain that you experience on the sides of your abdomen, lower abdomen, are called round ligament pains, and it is caused when these two round ligaments on both sides contract suddenly. So these are some of the common reasons for getting cramping or any sort of pain in your abdomen during pregnancy. Some of the other reasons could be, false labor if you are towards the end of your pregnancy. But for some women, these false contractions, or what we call as practice contractions, can start even as early as the 24th or 25th week. So these will be observed as tightening of the uterus. Sometimes you can even feel your whole abdomen tighten for a couple of seconds or even a minute, and then it will release. So again, this can be very mild or it can be quite intense that you will have to sit down for the minute that contraction is. As long as your contractions are not very regularly, timed, and it is not increasing in intensity, you don't have to worry. Like for example, you're getting one in the morning and then there's nothing much, you're getting another in the evening or the next day, and it's very irregular and erratic, then you will understand that these are false labor contractions, or what we call as Braxton Hicks, and you don't have to worry. So some of the other reasons that you don't have to worry about if you have cramping could be, if you have had sex. So usually after sex or orgasms, the cervix, the vaginal muscles, and the uterus will be contracting a little. That is normal. You could also be experiencing a little cramping if you have been exercising. So if you experience cramping when exercising, take a break. And you could also experience these crampings or mild pains if you are experiencing gas, bloating, or constipation. Like constipation is very common during pregnancy, so you could be experiencing cramps for any of these reasons. One more final reason could be if you're dehydrated. So always ensure that you are drinking a lot of water when you are pregnant. Now, when should you contact your doctor? And what are the signs that you will have to note or look out for when you have cramps? So the first is, if the cramping is very severe in intensity, you will have to definitely talk to your doctor. The second is if cramping is accompanied by any type of bleeding, dizziness, or lightheadedness. Again, like I told you before, if it isn't regular, the cramping or the contractions are in regular intervals and they increase in intensity as time passes. Also, if you experience any sort of burning when urinating, any pain in your lower abdomen or burning when you're urinating, or you're not able to urinate well, along with cramps, this could be an indicator of a urinary tract infection. So for this, again, you will have to contact your doctor and get it rectified. Another thing is if you have vaginal yeast infection. So this could be if you're having contractions or pain in your lower abdomen along with itching around your vulva. You could also be experiencing very foul smelling, creamy, decolor, that is like yellow, sort of yellow, sometimes even brown vaginal discharge. Then it could be a vaginal yeast infection. And for this, again, you will need to get treated by your doctor. In case you have fever, along with cramping, or you have a lot of increased watery discharge, you may experience a lot of intense back or abdominal pain that is combined with nausea, vomiting, and or fever. And especially if you experience a sharp pain on any one side of your abdomen, especially in early pregnancy, and it is sometimes accompanied by shoulder pain, then you will have to rush to your doctor, because this is a sign that this could be an ectopic pregnancy. An ectopic pregnancy is when the fertilized embryo gets implanted anywhere outside the uterus, like the fallopian tube or somewhere near the ovaries. Then this is a very dangerous, critical situation, because if it is there for long without being diagnosed, your fallopian tube can rupture and it is a life-threatening situation. So if you feel any sort of pain, on only sharp shooting pain that is lasting, that is long on any one side of your uterus, especially in early pregnancy, along with shoulder pain, please go to your doctor. Another thing is if you experience any cramping along with headaches, pain in the upper side of your stomach, like the right side, any vision disturbances or sudden swelling of your hands, feet, and face, then you would have to rush to your doctor, because this is a sign of pre-eclampsia, and pre-eclampsia also needs medical intervention immediately. Okay, so these are some of the signs. So now that you know the signs, be very cautious. And if you experience any of this along with cramping, then you will have to meet your doctor as soon as possible. Now, if you're having mild cramps and you know that they are normal, so what can you do to get a little bit of relief from it, when you are at home? So the first would be to take rest. If you have been standing, walking, or exercising, or doing something, then change your position, go sit for some time, lie down for some time, or take a nap. Second, drink a lot of water to ensure that this is not brought on by dehydration. Also, if it is by constipation, increase the amount of fiber that you are taking and also increase your water intake. You could also try taking a warm bath, or a warm shower, or in case you have a tub at home, you can take a warm soak in the tub. This will help relax all your muscles and hence, reduce the amount of cramping that you're experiencing. Always wear very comfortable clothes that are breathable and not too tight, okay? Something that can stretch, because tight clothes can also make you feel very uncomfortable and it will cause your muscles to, contract and tighten, okay? Also, if it is very unbearable, you're having a lot of round ligament pain and a lot of cramping as well, you could always talk to your doctor and ask them for a recommendation of a pregnancy abdominal support belt. You get these online or in a lot of pharmaceuticals or pharmacies around you. So you can get one in a size that suits you and you can wear it for some time on the day. This will hold up your abdomen and it will lessen the amount of sagging that is there, and it will help remove the strain from a lot of your muscles, especially your core muscles and your back muscles that are holding the weight of your abdomen. Okay, so these are some of the things that you can definitely try out at home and see if it is helping you. In case you try any of these and it actually helped you a lot, please do comment below this video so that we know that what we are giving you is all the information that we're giving you is helping you. It would also help a lot of other women who are looking at this video, watching this video and looking at the comments below. Right? So now cramping is normal most of the time. So in case again, I'm reminding you, in case you experience any of the above symptoms along with crampings, all that we discussed in the video, then you will have to rush to your doctor immediately. Okay. Now don't panic too much. It's okay. It's normal to experience the occasional pull. So don't worry and enjoy your pregnancy. Now, if you found this video useful, don't forget to press the follow button. Also comment below, subscribe, and like this video so that you get a lot of other updates as well. Please do check out the link in the description to join my pregnancy masterclass to know more information about all the courses that we offer and to become a part of our community at the Babypedia tribe. I will meet you soon in another interesting video just like this. Till then, take care with lots and lots and lots of love and strength to you. This is Saranya signing off.